Are you confused about the difference between Medicare Advantage and Medicare Supplements? Do you know what each type of insurance is and how they differ? Unfortunately, there's a lot of misinformation out there regarding these two categories of Medicare coverage, so this presentation will explain each and the advantages and disadvantages of each. Medigap is just another term for a Medicare supplement, or also called a Med Sup. Medigap plans fill most of the 20% that Medicare does not pay. Medigap and Medicare Advantage plans are different types of insurance. Both are provided by private insurance carriers. Both work with and are approved by Medicare. You can't have both. You typically must choose one or the other when you sign up for Medicare. Medicare itself has 4 parts: A, B, C, and D. To help you remember, think A for admissions. Part A helps to cover admissions into the hospital. Think B for basic. Part B helps to cover family doctor visits, outpatient surgeries, etc. Pretty much everything except an admissions into the hospital. Part C is for combined. Parts A, B, and usually D combined make up what is known as Medicare Advantage, which we will talk more about later. And finally, Part D is drug coverage. Together, Parts A and B are called Original Medicare because they were the only 2 parts when Medicare was first established in 1965. A major issue is that Parts A and B together pay only about 80% of your medical costs. As of 2023, there's a $1,600 hospitalization deductible, meaning you are responsible for this full amount before Medicare will pay anything if you are hospitalized. Also, A and B alone do not cover prescription drugs. And finally, A and B alone do not offer routine dental, vision, or hearing coverage. Most importantly, with A and B alone, there is no upper cap on how much you could be liable for. After you receive your Medicare A and B card, you generally have one of 2 paths to choose from. Neither is required, but choosing one or the other can help you avoid late enrollment penalties for Part D coverage, provide more comprehensive coverage, and help you reduce your maximum out-of-pocket liability. Those 2 options are either 1, buy both a Medicare supplement and a prescription drug plan, or 2, enroll in a Medicare Advantage plan, Part C, that includes prescription drug coverage. It's important to understand that a Medicare supplement is not the same as Medicare Advantage, and you should not have both at the same time. To cap your financial liability for medical care, you should choose one or the other after you enroll in Parts A and B. So one more time, for fuller coverage, a Medicare supplement plus a drug plan, or a Medicare Advantage plan that includes drug coverage. Now let's take a look at the first option, a Medicare supplement plus a prescription drug plan. Medigap, or also known as Med Sup plans, are health insurance policies sold by private insurance companies. They help to cover the 20% that Medicare doesn't. They do not include Part D drug coverage. You will have to buy a drug plan separately. So what are the advantages of a Medicare supplement? Well, first, they cover all or most of the 20% that Medicare doesn't, depending on which supplement you choose. There are no copays or fees for a provider or service after you hit the annual deductible, which is $226 in 2023. A second benefit is you can go to any doctor who accepts Medicare. Also, plan benefits are constant from year to year. Your financial liability is capped at the total cost of your premiums plus the annual deductible. There are very few, if any, prior authorizations. Sounds great. So what are the disadvantages of Medicare supplements? Well, first, there's an additional monthly premium that usually begins around $120 for a supplement plus a drug plan for a 65-year-old and can go as high as $400 per month. Those premiums typically increase as you age. You must buy a drug plan in addition to the supplement. Supplements typically do not include dental, hearing, or vision benefits. Think of a Medicare supplement this way. You are paying in advance for medical care. You pay an additional monthly premium for the security of knowing that if you have a major medical event, you will pay little to nothing after the annual Part B deductible of $226 in 2023. Because you are paying for medical care in advance, the risk in paying for a Medicare supplement is that you will pay a monthly premium for care that you may never use. Now let's take a look at the second option, a Medicare Advantage plan. A huge benefit of both Medicare supplements and Medicare Advantage plans over original Medicare A and B alone is that they both cap out-of-pocket medical expenses. Medicare Advantage plans must cap your out-of-pocket maximum for network providers at $8,300 per year in 2023, depending on the plan, though some plans may have lower caps. There are a number of Medicare Advantage plans that are available at $0 to a very low dollar monthly plan premium. Unlike a Medicare supplement, Medicare Advantage plans have co-pays for various services. You could say Medicare Advantage plans are more pay the 20% as you go instead of pay in advance like Medicare supplements. So to recap, what are the advantages of Medicare Advantage plans? Well, first, they have low copays, anywhere from $0 to $5 for primary care doctor visits, for example. Low or no additional monthly premiums in many locations. You can change plans every year during annual enrollment and once during open enrollment if you aren't satisfied with your plan. Drug coverage is usually included. Dental, vision, and hearing benefits are often included. So what are the disadvantages of Medicare Advantage plans? Well, first, there are copays for many services. The plan benefits may change from year to year. You must use network doctors or facilities if you're in an HMO, or for the best price if you're in a PPO. You may not qualify for a MedSup later if your health declines and you decide that you want to switch to one instead of a Medicare Advantage plan. Your plan may require referrals or prior authorizations for certain procedures. Your plan may limit your number of days in a skilled nursing center for rehab. Some questions to consider when choosing your Medicare options. Number one, can I afford an additional $125 to $150 in monthly premiums? Number two, do I prefer to have a fixed medical bill every month even if I never use it? Number three, am I in good, average, or poor health? And number four, is it critical that I visit one specific doctor or hospital? Do you still have more questions? If so, for additional local help at no cost to you, you can call, text, or email me. My name is Michael Crocker. I'm a licensed agent specializing in Medicare. I serve all of the upstate South Carolina. My number is 864-214-4261, or you can email me at michael@crockerlife.com.